COVID-19, the primary mode of defense against COVID-19, that is face mask. So we'll be talking about face mask in particular, and after us, Dr. Kanksha Monga will be talking about sanitizer, that is the defense against COVID-19, how to kind of, take it away. Now we are talking about defense. So face mask is the primary way in which we defend against COVID-19. So now the history tells us that an informed and activated population is vital to protecting public health. So that is why we are basically doing this particular webinar. We want you to be informed and activated so that you can protect your health as well as you can tell the public and activate the population around you, the people around you, be they your own family members or your friends, that what is the importance of face mask and what is the importance of hand sanitizer and hand hygiene in improving your health in general and in prevention of COVID-19, the present pandemic. Like 4 months ago, we had no idea that we would be here at the place where we are. The things suddenly changed, and so we have to change ourselves. We have to adapt ourselves with the new normal, which it is being called now. So an important thing about adapting to the new normal is to get new behaviors, to develop new habits. And one of the new habits that we ought to develop is the habit of wearing a mouth mask. The mouth mask is the primary thing which we should all start using now if we are to save ourselves as well as our surroundings and the surrounding people from this deadly disease, this deadly pandemic. So it's only if we are activated and if we know that how we can use this particular public health intervention in the right way, that we will be able to use it to our benefit. So our primary motive here in this talk is to activate you and let you know about the right way of using face masks. Now we have here people who are from medical background, we have people who are not from medical background. So we have adapted this particular presentation in such a way that it will cater to both the populations, medical people as well as people who are not from medical background. So this particular presentation, we will start with having a bit of snippet about what has been the timeline or the history of masks. Now, by the Middle Ages or by the medieval time, people had started covering their nose and mouth in Europe to safeguard themselves from contagious diseases. So there have been various contagious diseases in the past, particularly in Europe, the plague being one of them. So learning from that, there had been some kind of covering of face by the people in order to protect themselves from various contagious diseases. But it was not until 1897 that John Mikulicz, who was the head of surgery in the department of Wrocław in Poland, he started using the face mask. So what he did was that he used a very rudimentary face mask at that time, which was a piece of gauze that was tied with 2 strings to a cap, and it swept across the face so as to cover the nose and the mouth as well as the beard. So that was the idea, the first idea of face mask. So by 1923, over 2/3 of the surgeons in Europe, they used face masks, whereas during 2018-19 influenza pandemic, wearing face masks, it became mandatory for medical workers, police forces, and even residents in the US cities. So that was a time which was something which was closer to what it is now. So right now, we have again come to a point where it has become important for each one of us to wear a face mask. So that was a brief kind of history of face mask. So in today's presentation, if we can go to the next slide, we will talk about the 3 categories of face masks in general, right? We are not going to, go into the bewildering area of face masks which are there present in the market, but we are going to limit ourselves to the three categories of face masks, that is cloth face masks, surgical face masks, and respirators. So I would first try to tell you, I'll just tell you about very quickly the basic features of these three types of face masks. First of all, the two types of face masks, that is the respirators and surgical mask, they are classified as therapeutic devices. So the surgical face mask as well as the respirators, that is, we are going to talk here about KF80 and N95. Those are the two kinds of respirators which we are going to talk about. So all three of these are therapeutic devices according to the FDA, or Food and Drug Administration of the US. And they have to have very strict specifications about how they're going to be made, what are going to be their dimensions. As compared to these, the cotton mask or the cloth face mask, which people use in general, these are not FDA approved and they are not therapeutic devices, so they can be flexible in their design. So that's why you can see various face masks which are adapting to the fashions, and various face masks of various different type of clothes which are coming up, because they are not approved by FDA, and they can do that, and they are, very much welcome to do that. So about the intended use of these masks, the surgical face masks are basically to protect the patient from large particles except from the, expelled from the wearer, such as spit and mucus. So they are firstly for patient protection, and second is they are used as fluid barriers, so they also protect the clinician when they are used. So they are basically helpful in solving the problem of cross infection in operatories, because they act as fluid barrier as well as they act as barrier, so that there is no crossover of infection from either the patient to the clinician or the clinician to the patient. In comparison, the cotton face masks are basically barriers which prevent the person from touching the nose and mouth. And they also help to contain spit or mucus, which is expelled by the wearer. And it is similar to covering the cough and sneeze using a handkerchief or a face tissue. Now, in comparison to this, the respirators, they usually have a very high filtering efficiency of about 90%, 80% to 95%. And they usually help to reduce wearer's exposure to fine dust particles and also to infectious airborne particles. So that is their intended use. Now, all of these face masks, except the respirators, they loosely fit on the wearer's face, whereas the respirators, they are designed in such a way that they are designed to fit tightly, and they are designed to have a seal between the face and the mask, that is the skin of the face and the mask. So there's a very tight seal between the face and the mask surface. So if we can go to the next slide, we'll see that all of these are disposable except the cloth face mask, though in present the circumstances are such, because in some parts of the world there is a shortage of these face masks. So there have been guidelines to reuse these masks, but strictly surgical masks are not to be reused, whereas cloth masks can be recycled, reused and cleaned, whereas there have been guidelines on how to clean and how to reuse the respirator. So we are going to talk about these guidelines a bit later, that what are the guidelines if we are to reuse these masks, okay, and what are the cleaning guidelines for the cloth face masks. Now there's also a significant difference between the basic structures of all these masks. So when we talk about surgical mask, it's a 3-layered mask. It usually has 3-layered construction, and it's plated in a rectangular mask having a nose piece wire and a It has a tie or ear loop in order to tie it around the head, or fix it around the ear if it's so designed. The cloth mask, it's usually a rectangular mask, but now there are various shapes and sizes in which it comes, and it usually has ear loops so that it's easy to fit. Now, the respirators are usually 4 layers to 6 layers in construction, and they usually have 3 flat fold, and they are usually cup shaped to adapt with the face of the anatomy of the face. They always have a nose piece wire, and they have a headband or ear loop with a hook fastener to adapt them. Both the surgical mask as well as the respirators KF80 and N95, they are made of non-woven fiber, whereas cloth face masks are usually made of cotton. The final talk is about the fluid resistance. No mask except surgical mask is fluid resistant. It is only surgical mask which is resistant to fluid. So this was about an introduction to the face mask and the type of face masks which we are going to talk about in today's webinar. I would invite Dr. Pooja to take you through to the next part.
Thank you so much, Dr. Ankur sir. Now here we can see 4 individuals: healthy individual, infected individual, health professional, and vulnerable person. These icons will help you throughout the presentation to know that which mask has to used by which person, which individual, and which individual has to take what type of precautions. Now, there are always some questions in our mind regarding everything, and it's obvious that we have some questions regarding the face mask. So here the first question that might hit our mind is, should I wear a mask? So WHO has maintained for a long time that effectiveness of face masks for public was not evidenced. But there are some studies which prove some evidences, like in 2010. There are fewer data to support the use of masks and respirators to prevent become infected. And then 2012, 8 out of 9 retrospective studies found that masks and respirators use was independently associated with a reduced risk of severe acute respiratory syndrome, that is SARS. As we know that both COVID-19 and SARS are caused by coronavirus. The virus causing SARS, we called it SARS-CoV, and the virus causing COVID-19 we called SARS-CoV-2. Then in 2008, any type of journal mask use is likely to decrease the viral exposure and infection risk on population level. There is no shortage of mechanistic evidence and observational studies that affirm the benefits of wearing a face mask in the community, which should drive urgent public health policy while we await the result of further research. Then, in 2020, there is no valid scientific evidence to support assertion that use of face masks in community may impose a higher risk of infection on the ground of improper use or false sense of security. Then finally, WHO has said on 5th June 2020 that it has updated its guidance to advise that to prevent COVID-19 transmission effectively in area of community transmission, government should encourage the general public to wear masks in specific situations and settings as a part of comprehensive approach to suppress SARS-CoV-2 transmission that is caused by coronavirus, that COVID-19. The next question which came in our mind is, when should I wear a mask? So here is an icon of a healthy individual. Healthy individual should have to wear a mask in like public settings such as grocery stores, at work, social gatherings, mass gatherings, closed settings, including school, temples, churches, mosques, etc. because they are already very crowded and gathering places. Then people living in cramped condition and specific settings such as refugee camps, camp-like setting and slums. Then general public on transportation, on buses, planes, trains, and a specific working condition which places the employee in close contact or potential close contact with others, like social workers, cashier, and servers. These icon is of healthy individual. So a healthy individual can wear a mask of making a cloth material. Then there is a person of vulnerable. When should they have to wear a mask? Is setting where physical distancing cannot be achieved and increased risk of infection or negative outcomes. But they are not allowed to wear a cloth mask. They have to wear a surgical mask. Then we have health professional. Healthcare facility including primary, secondary, tertiary care levels, outpatient care, and long-term care facility managers. Then healthcare facilities including long-term care facility in setting where aerosols generating procedures are performed, home care and outreach. They are allowed to wear the respirators and surgical mask. Then now, when should a children wear a mask? This is a very general question that we in our family everyone is asking nowadays also, that we have a kid, they have to wear a mask or not. Then it is recommended that children younger than 2 years of age do not wear any type of mask because they have very small airways and they can struggle to breathe. Moreover, they can be unable to remove the mask without assistance. They are at increased risk of suffocation because they are very small. Under 2 years of age, they are very small. Surgical masks of smaller size suitable for children from 3 to 12 years old are marketed. Now, we have a type of mask: cloth mask, surgical mask, and N95 respirator. We divided into on the basis of characteristics and on comments of pediatric population and community. Then first one is cloth mask. The cloth face mask covering over nose and mouth in community setting to reduce the possibility that someone with no symptom could transmit the disease to others. And on the basis of pediatric population, the homemade or purchased cloth masks are suitable for average person to wear. For example, for a small child, ensuring the right fit is important. Children younger than 2 years should not wear a mask. This is actually a very recommended thing, that children younger than 2 years should not wear a mask. Then surgical mask. They are loose fitting disposable devices that create a physical barrier between mouth, nose of the wearer and potential contaminants in the immediate environment. Available of smaller size for children more than 3 years of age. Then N95 respirator, personal protective equipment that are used to protect the wearer from airborne particles and from liquid contaminating the face. On pediatric population, not recommended for general population. Only children who are considered high risk for severe complication or severely immunocompromised are encouraged to wear a N95 mask. We have not to give any children or any type of respirator until they are immunocompromised or at high risk for severe complications. Now, which type of mask should be worn by positive patient? So here is an infected individual. So infected individual should be kept in an isolation ward and they must have wear disposable triple layer mask only as given by NCDC guidelines, Government of India. Now I would like Dr. Ankur sir to take for the next questions.
Thank you, Dr. Pooja. So before I go ahead, I would like to tell you that in every slide here, we have an icon which tells that which particular population group the slide is relevant for. For example, this particular slide is relevant for healthcare professionals. It is also relevant, though it's not, the icon is not here, it's also relevant for general population here. And we've also marked or cited the place where we have got this information from. For example, this is from the journal Engineering, and it is published in 2020. So we have tried to be as updated as possible, and we have tried to find the information from as many sources as possible and as wide sources as possible. For example, this is an engineering journal, and there are various medical journals, healthcare journals, which we have searched. So whenever we are talking about something, just be assured that this is an evidence-based thing, first of all, and second, also see what particular population the thing which we are talking about is relevant to, though we will also tell you that which particular population this particular thing is about. So the next question that we want to answer is that can the mask be reused? I'd answered this partially in the beginning, that the masks are not meant to be reused. Most of the medical masks are disposable masks. Surgical masks are always, they have to be disposed. But because we are in a situation which is not very conducive to the use of traditional things or the traditional guidelines, so the guidelines, there have been some guidelines which have been given to reuse these masks. So yes, they can be reused. These masks can be reused, but there have to be certain guidelines which are to be followed before reusing these masks. So the first guideline which I want to tell you is about the home face masks or the surgical mask. This is useful for both of them, especially for the surgical masks, because some people and some population groups, they have to use surgical masks even though they are laymen and not healthcare workers. So this is for those people. This is primarily for healthcare workers, but also for those who are going to use surgical face masks even though they are not healthcare workers. Okay, and these may also be used for the cotton face masks. So this particular guideline tells you about the 3-step sterilization and reuse of the mask, which they call as regeneration of the mask, right? This regeneration treatment, it was developed by Professor Jian Fengchen of the University of Beijing, Beijing University of Chemical Technology. And it has 3 steps basically. The first step is sterilization, second is charging, and third is testing. A bit later on, I'll tell you that charging of face masks is very important in making the face masks effective, and it is one of the part of mechanism of action of face mask by which it prevents it actually prevents the transmission, right? So so far as these 3 steps are concerned, the first step is sterilization. In this step, we should soak the disposable medical non-woven mask, which is the same as surgical mask, not the N95 or the other respirators, but the surgical mask. We should soak this disposable mask in hot water above 56 degrees Celsius for 30 minutes, right? Now, we should avoid rubbing this mask, right? Because rubbing will spoil it. So avoid rubbing the mask, just dip the mask in hot water above 56 degrees Celsius for 30 minutes. Once that is done, dry it for about 10 minutes using electric hair dryer. Now this will also charge the mask, so they call this step as charging. Fine. So once the charging is done, we should test this mask for the electrostatic effect using paper bit. The paper bits will stick to it if it is well charged. If it's well charged, it's fine. If it's not well charged, you should follow the process again. So this is one of the ways in which the surgical face mask can be refurbished and regenerated for reuse. So in next slide, we will know that how the general population should clean the cloth face mask. So these are the CDC guidelines, CDC USA guidelines, and it tells that they can be cleaned in a washing machine or they can be washed by hand. In washing machine, it's simple. You use it with the regular laundry, and you use a detergent and keep the washing machine settings in the warmest possible water setting, right? While washing by hand, it's important that bleach be used. If you don't have a bleach, you can make your own bleach by adding 5 tablespoons of a household bleach per gallon of water at room temperature, or 4 tablespoon bleach per quarter of room temperature water. So now these should be soaked for 5 minutes and then rinsed thoroughly with cool or room temperature water. That will make it clean for reuse, the cloth face mask, which we usually use at home. So all we have to do is to use a bleach, soak it, and then wash it. Okay. Whereas if we are using washing machine, we should use warmest possible water. So this particular guideline is for the general population. All of us can use this when we are using a cloth face mask. So the next in particular is about the N95 respirator. If we can go to the next slide. For N95 respirator, there are 2 processes, and this is more pertinent to the healthcare professionals. So there are 2 processes which are usually undertaken. The first is use of ultraviolet radiation, and the second is use of fumigation. So in using ultraviolet radiation to refurbish the mask, we usually have 2 towers, with each tower containing about 8 ultraviolet C bulbs, as it is shown in the diagram here, right? It is in a room where the walls are coated with the reflected paints. The masks are hung from the cloth line, and every room, it usually has roughly a capacity of 90 masks. 15 minutes of ultraviolet C radiation is enough to kill these masks. So this is a pretty fast process of refurbishing the mask. It just takes 15 minutes time, and it uses ultraviolet C radiation. The next is fumigation. Now, Duke University was the one who started fumigation of face masks, and they're even now using the fumigator, which exposes the mask to vaporized hydrogen peroxide. Now, depending on the machine used, the hydrogen peroxide, its concentration may differ. At usually 300 to 750 ppm of hydrogen peroxide is used for about 20 minutes of time. Now, once this is done, the 20-minute cycle is over. The most time-consuming part is that you cannot go in before the degassing has been done, because hydrogen peroxide and nascent oxygen, which is present over there in that particular room, is not a very good thing to be with. So it usually takes 4 hours before the decontamination takes place. But once the decontamination has taken place, you can get the masks, and these masks are refurbished and ready to use. So these are the 2 ways in which we can, reuse the N95 respirators. Now, the next thing which I want to talk about is that for the home face masks, how do they fare against the respirators and the surgical face mask, and which is the best cloth to choose? Now, this particular study, it compares N95 respirators, surgical masks, and various different, and the clothes which we can use for home face mask. And there are some striking similarities between the particle size which we can filter and the percentage of particle size we can filter with our own home face mask with particular clothes, with particular clothing choices, as compared to the non-home or the surgical respirators and the surgical masks. So if we see, there are 2 columns. The first column tells about the percentage of less than 300 nanometer particles which are filtered. The second tells us about the percentage of more than 300 nanometer particles which are filtered. If we see, when there is no gap between skin and surface of N95 respirator, then N95 respirator is able to filter about 85% of less than 300 nanometer average particles, whereas it is able to filter 99.9% of more than 300 nanometer average particles, which is pretty much when compared to the surgical mask with no gap. Now, the problem with surgical mask is that there is always some kind of gap over there. Okay, so surgical masks usually, they filter about 50 to 44% of the particles less than or greater than 300 nanometer in size. Now, if we go down and see that if we have a cotton flannel mask, which is hybrid number 3 right at the end, it filters about 95% of less than 300 nanometer average particle size particulate matter, whereas it is able to filter as much as 96% of greater than 300 nanometer size. Now, this is a standalone study, but it just shows how promising these cloth face masks with different clothing combinations may be. They can be as good as the N95 respirators in some cases, and if you see, the flow rate is also greater with these, so they may prove in future to be more like easier to wear, as well as having almost similar efficacy as compared to the N95 mask. Now, if we go to the next part, it will tell us that why particularly these cloth face masks, when used in combination, may be as good as the N95 masks. So the thing is that we usually think of these N95 masks as filters, just like sieves which we use to sieve off milk, in our kitchens. Though that is not the mechanism of action which occurs with N95. Now, N95 masks, they usually filter more of medium-sized particles which tend to flow with air into the masks, and they tend to maneuver the holes of the face mask or the filters of the face mask and tend to pass through them. Now, what exactly N95 does is that it works with two things. First is that there are multiple layers, about 3 to 6 layers in N95 mask, which filter the air, the medium-sized particulate matter by, making the airflow turbulent instead of the air flowing very coolly inside. So it makes the airflow turbulent, due to which the particulate matters, they get zigzag rather than moving in a straight line or maneuvering through the holes. So they get stuck in that on the surface of the respirator. So that is one way in which it filters. The second way is that N95, it has electromagnetic field. It is positive and negative fields, due to which it tends to create positive and negative fields in the particulate matter, because of which the particulate matter, it tends to stick to the surface of N95 rather than get in. So it's not a sieve mechanism, but it is these two mechanisms which occur in N95. Now, in a hybrid face mask, face mask using two different cloths, this is almost the same which occurs in N95. It traps the aerosol, and whatever the aerosol is left, it traps it again or makes it sticky by electrostatic filtration. So that is how fusion face masks, or face masks that use two types of clothes may prove to be as effective as N95 face masks in future. So that was about the question on which is the best cloth to use for a cloth face mask. Next, I would invite Dr. Pooja again to take on next question on harms and disadvantages of using face masks.
Thank you, sir. Now, next question which came in our mind is like, are there any harms or disadvantages of face masks used by public? Yes, there are many disadvantages. Like, first one is self-contamination. If we touch our front portion of the mask, it should not be touched. But if we touch, then there is no use of using the mask. The next one is headache and breathing difficulties. Like, if someone is having respiratory problems, then they must have some problem in wearing a mask. Then facial skin lesions due to some allergy. Then difficulty in communication, false sense of security, improper disposal, and difficulty in wearing. Now, what is the right way of wearing a mask? The first, wash your hands before putting on your face covering. Put it over your nose, mouth, and secure it under your chin. Try to fit it snugly against the side of your face and make sure you can breathe easily. The last thing, that is make sure you can breathe easily, is actually the main concept. This should always be asked to someone in our family and everywhere, that they should not feel any uncomfortable in wearing any type of mask. And this is not a right way to wear a mask. Now, we will show you two videos. The first one, how to wear a N95 mask, and second is how to perform fit test and remove N95. The first one is wearing N95 mask.
Protect yourself and your loved ones. Here are the 6 steps to wearing the N95 mask. Step 1. Wash your hands before putting on the mask. Step 2. Select an N95 mask that fits you well. It's available in different sizes and models. Step 3. Hold the mask in your hand and place it firmly over your nose, mouth, and chin. Step 4. First, stretch and position bottom band under your ears. Then, stretch and position top band high at the back of your head. Step 5. Press the thin metal wire along the upper edge gently against the bridge of your nose so that the mask fits nicely on your face. Step 6. Perform a fit check by breathing in and out. While breathing out, check for air leakage around your face. Protect yourself and your
Now, next video we'll see how to perform fit test and remove N95.
The 3M 1870 is a 3-panel flat-fold particulate respirator and surgical mask. Follow these instructions each time you don your respirator in order to achieve a proper fit. Remove the respirator from its packaging and hold it with straps facing upward. Place the bottom strap under the chin panel next to the warning statement. Fully open the top and bottom panels, bending the nose piece around your thumb at the center of the foam. The strap should separate when the panels are open. Make certain the bottom panel is unfolded and completely open. Place the respirator on your face so that the foam rests on your nose and the bottom panel sits securely under your chin. Pull the top strap over your head and position it high on the back of the head above your ears. While holding the respirator firmly on your face, pull the bottom strap over your head and position it around the neck and below your ears. Make sure the straps are not twisted for increased comfort. Adjust for a comfortable fit by pulling the top panel toward the bridge of your nose and positioning the bottom panel under your chin. Place fingertips from both hands at the top of your nose and mold the nose piece around your nose to achieve a secure seal. Push inward while moving your fingers down the side of the nose piece. Note, always use 2 hands while molding the nose piece. Pinching the nose piece with one hand may result in improper fit and less effective respirator performance. Perform the user seal check each time you don a respirator. To conduct a user seal check, place one or both hands completely over the middle panel, cupping hands over the respirator and covering it as much as possible. Pay careful attention not to disturb the position of the respirator. Inhale and exhale sharply. Be careful not to disturb the position of the respirator. It is important to have a good face to respirator seal. If air leaks around the nose, readjust the nose piece for a more secure seal and repeat the user seal check. If air leaks around the respirator edges, adjust the position on the face and the straps along the sides of the head and repeat the user seal check. Do not enter a respiratory isolation or other hazardous area where respirators are required until you are assured of a proper fit. If you have difficulty achieving a fit, review the respirator user instructions located inside the packaging or refer to the instructions on the 3M 1870 Wear It Right poster to ensure that you are following the correct procedure. If you are still unable to achieve a fit, see your supervisor or a representative from your infection control or employee health and safety departments. Do not enter a hazardous or infectious area. To properly remove the respirator, do not touch the face piece. Slowly lift the bottom strap from around your neck up and over your head, while keeping the respirator seated against your face. Lift off the top strap. Carefully remove the respirator without allowing the outside of the respirator to come in contact with your body. And perform hand hygiene. 3M recommends you practice this removal procedure until you are proficient and comfortable with the procedure and before actual use of the respirator for the first time. Leave the hazardous area immediately and replace the respirator if it is damaged, difficult to breathe through, or contaminated with blood or body fluids. Follow your facility's infection control policies and procedures for guidance on how frequently you should replace your respirator. Follow the proper fitting procedures each time you wear the respirator. When in doubt, review the user instructions, including the user seal check instructions. If a proper fit cannot be achieved, do not enter the area requiring respiratory protection. Follow up with your supervisor. Keep in mind that when you are wearing a respirator, it helps reduce potential exposures if the respirator fits you properly. You wear it during all times of exposure, and use of the respirator is under an effective respiratory protection program as required by OSHA 29 CFR 1910.134. Refer to the OSHA website at www.
This was all about how to wear N95 mask and how to perform fit test and remove N95. Now, let's go to next question, that what is the right way to dispose a mask? This is a very important question. Otherwise, it will lead to disadvantages of wearing a mask. Now, used mask should be considered as potentially infected. Mask should used by patients, caregivers, close contacts during home care should be disinfected using ordinary bleach solution 5% or sodium hypochlorite solution 1%, and then disposed of either by burning or dew burial. Medical masks and respirators should be disposed of in red bins only. Now, I would like Dr. Ankush again for adding some additional information on mask.
Thank you so much, Dr. Pooja, once again. So before I go on with this, I would like to tell you that you can ask your question by typing on the question tab, which is on the right-hand side of the corner of your screen. So we will take it up at the end of both the presentations, whatever questions you have. So those were the 10 questions which we could, think that which would be relevant. Now, there are some snippets of additional information about respirators, surgical mask, and in particular about N95, which I would want to just run through. So now, how do these names come? So, and the notations for the respirator, they are obtained by the letters N, R, and P. N means not resistant to oil, R is somewhat resistant to oil, and P is strongly resistant to oil. Now, the N95 respirators, they remove 95% of airborne particles of size of 300 nanometer, whereas N99 respirators, they're able to reduce 99%, and N100 about 99.97% of airborne particles. So next, a few snippets about surgical masks. We should take care, that while surgical mask, it may be effective in blocking splashes and large particle and droplets. A face mask by design does not filter or block very small particles in air that may be transmitted through coughs, sneezes, or certain medical procedures which may produce these aerosols. So these medical procedures may be something like use of the aerator. So surgical mask does not help with that. Surgical masks also do not provide complete protection from germs and other contaminants because of the loose fit between the surface of the mask and between your face. The third is that surgical masks are not intended to be used more than once. So these three things we should always bear in our mind. Now, a bit about N95 mask. N95 masks should not be used or should be used only after consultation with the physician by people with chronic respiratory, cardiac, or other medical conditions that make breathing difficult. Okay, and if one wants to use it, one should always use it after, consulting with the medical care providers. Now, some models have exhalation valves that can make breathing out easier and help reduce heat buildup inside the mask, so that makes it a bit more comfortable. But one should note that N95 respirators with exhalation valves should not be used when sterile conditions are needed. So we don't recommend the use of these things, especially in our clinics. Now, N95 respirators are not designed for children and people with facial hair because proper fit cannot be obtained or achieved in children and people with facial hair. So N95 respirator may not provide full protection for these people. So next is that, am I completely safe after wearing a face mask? The answer is that no, you are not completely safe. Face mask is only one of the public health measures to defend from COVID-19. Hand hygiene, social distancing, and respiratory hygiene, all three of these go hand in hand to protect from COVID-19 prevention. We should not think that if we are wearing face mask and we are immune. We cannot be close to people and we cannot skip hand hygiene even if we are using a face mask. So all three of them are important. Use of face mask is just one of the things. With this, I would like to recall, what Kiran Mazumdar-Shaw said. Ultimately, the greatest lesson that COVID-19 can teach humanity is that we are all in this together. So I would like to wind up my presentation at the end, and I would like to invite Dr. Akanksha Monga for her presentation on hand sanitizers.